Hello, so today we're gonna talk about an appropriate first aid for insect stings. So what to do when you have a insect stings? So reassure the causality. If you can see the sting, brush or scrape it off sideways with something firm like a fingernail, credit card, or plastic ruler. The second one is raise the affected area and hold something cold against the injury to help reduce the swelling, like an ice pack or a frozen bag of vegetables wrapped in a tea towel. And lastly, monitor their breathing and level of response.
Animal bites. What is animal bite? An animal bite is a wound, usually a puncture or laceration caused by the teeth. An animal bite usually results in a break in the skin but also includes contusions from the excessive pressure on body tissue from the bite. The contusions can occur without a break in the skin. Bite can be provoked or unprovoked. Some animals can bite: bat, raccoon, fox, skunk, dog, and cat. How do you treat an animal bite? What to do? Wash the bite area with soap and water. If the bite is bleeding, put pressure on it using sterile gauze or a clean cloth. If the bleeding has stopped, put antibiotic ointment on the area. Cover the area with a bandage or sterile gauze. If your children has pain, give acetaminophen or ibuprofen. What are the symptoms of an animal bite? The following symptoms may indicate infection or the presence of debris in your wound. Localized redness around your wound, warm around the bite area, red streak leading away from the bite, a fever, pus, swelling, pain. What is the most common risk of an animal bite? The vast majority of animal bites are caused by dogs, 85 to 90%, with the remainder caused by cats, 5 to 10%, and rodents, 2 to 3%. Children are bitten more often than adults. The most weird complication of an animal bite is rabies, although skin infection is the most common complication. What first aid should be given for animal bites? Wash the wound with soap and warm water. Gently press a clean cloth over the wound to stop the flow of blood. Apply an antibacterial ointment to the wound. Cover with a sterile bandage.
And cause itchy rashes when touched. Poison ivy may come to mind, but many common garden plants can also be skin irritants for sensitive people. Sometimes it is just a certain part of the plant that irritates, like the sapropyrophobia of the roots of hyacinth. Although for the some extremely sensitive people, any part of the plant they are affected by can cause irritation. Farming and gardening activities involve direct contact with various plant species. While most plants are harmless, there are certain plants that can cause varying degrees for skin irritations and injuries. Some people are more sensitive to certain plants than others. It is important to identify potentially dangerous plants and know how to avoid contact whenever possible. When contact is unavoidable, certain precautions should be made both during and after contact to minimize the severity of reaction or injury. Generally, there are 5 categories of harmful plants: poison plant, allergic plants, skin irritant plants, stinging plants, and thorn pickle plants. Types of plant irritation. Number 1. Chemical irritation. In the common case of poison ivy, the irritating chemical compound urushiol is absorbed right into the skin. Some people remain unaffected, while others can have an extreme reaction. Unfortunately, just because you've been immune to urushiol in the past does not mean you will never be affected by it. So everyone should use caution around poison ivy plant. Irritating chemicals also be transmitted to your skin in the winter when a plant looks dormant. Number 2. Light sensitivity. Some plants are irritants only when they are exposed to sunlight, which also happens to be when most people are in gardens. This is the case of plants in the carrot family like parsnip and Queen Anne's lace. Number 3. Chemical injury. Plants such as nettles have sharp edges or thorns that can break the skin and introduce their toxins through the wounds. How to treat plant irritation? First aid. People who have come in contact with poisonous plants should first immediately rinse skin with rubbing alcohol, specialized poison plant washes, degreasing soap such as dishwashing soap or detergent, and lots of water. Rinse frequently so that wash solution do not dry on the skin and further spread the urushiol. Scrub under nails with a brush. Apply wet compressed calamine lotion or hydrocortisone cream to the skin to reduce itching and blistering. Follow the direction on any cream and lotions. Do not apply to broken skin, such as open blister. Oatmeal baths may relieve itching. An antihistamine, such as diphenhydramine, Benadryl, can be taken to help relieve itching. Follow directions on the package. Drowsiness may occur. If children come in contact with work clothing contaminated with urushiol, a pediatrician should be contacted to determine appropriate dosage. In severe cases, or if the rash is on the face or genitals, seek professional medical attention. Call 911 or go to hospital emergency room. If the people is suffering a severe allergic reaction, such as swelling or difficulty breathing, or has had a severe reaction in the past.
Hi guys, for today's topic, we're talking about diarrhea. Oh, what is diarrhea? Diarrhea is a very common happening in the most people a few times each year. When you have diarrhea, your stool will be loose and watery. In most cases, the case is unknown. It goes away on its own after a few days. Diarrhea can be caused by bacteria, and dehydration is a dangerous effect or a side effect of diarrhea. Diarrhea can happen for a wide variety reason, and it usually goes away on its own into 1 and to 3 days. When you have diarrhea, you may need to quickly run to the bathroom with urgency, and this may happen more frequently than normal. You may also feel bloated, have lower abdominal cramping, and sometimes experience nausea. Diarrhea can cause dehydration, which means that your body does not have enough fluid to work properly. Dehydration can be serious, especially for children, older adults, and people with weakening immune systems. So, in the next slide, who can get diarrhea? Anyone can get diarrhea. It's not uncommon for many people to have diarrhea several times a year. It's very common and usually not a major concern for most people. However, diarrhea can be serious in a certain groups of people, including number one is young children, number two is older adults, number three is those with medical conditions, and the last one is for each those people, diarrhea can cause other health problems.
These are the steps of how you first aid a person have diarrhea. First, you should call the 911 if the person or child is very dehydrated, unresponsive, and has fainted, has severe abdominal pain, treating dehydration. First, you should take fluids. Ask your doctors what fluids are the best for you or your child. Here's some basic tips. Give an adult plenty of clear fluid like fruit juices, soda, sports drink, and clear broth. Avoid milk or milk-based products, alcohol, apple juice while you have diarrhea, and for 3 to 5 days after you get better, they make diarrhea worse. The number 2 is you have to rest. Have the person rest as needed and avoid strenuous exercise. Keep a sick child home from the school or daycare. And is on to eating. Feed an infant or child easy digest foods. The bread diet like bananas, applesauce, and toast is a good choice as soon as they can tolerate food. For an adult, add semi-solid or lower fiber foods gradually as their year stops. Avoid spicy, greasy, and fatty foods. When to call a doctor. Call a doctor if you suspect that you or your child is dehydrated. An infant 3 months old or younger has vomiting or diarrhea. There is a blood or mucus in the stool or the stool is black. An over-the-counter diarrhea medication seems to have worse diarrhea. These are the follow steps. Also seek medical attention if you or your child has any other medical problems and has diarrhea. The other one is diarrhea is an adult worsens or doesn't clear up after 2 to 3 days. A child doesn't feel better after 24 hours.
So, hello guys, I'm Group3 from 12 Corinthians, and today I will going to discuss the droning and the appropriate first aid of droning. So, what is droning? Let's find this out. What is droning? Droning occurs when victim struggles to breathe while in the water. So during droning, water enters through the nose and mouth and causes the person to initially gasp for air and swallow small amount of water. What follows is the natural reflex to hold one's breath before the urge to inhale become overwhelming. So there are two types of or two possible things happen when droning: dry droning and wet droning. So what are these two? What this means? In dry droning, water reaches the voice box and triggers laryngopasm, which completely closes the airway. The person is unable to breathe air and get asphyxiated. So in wet droning, the laryngopasm is only partial, so water enters the lungs and renders them incapable of performing their functions of oxygenating in the blood. So what do we need to do if there is someone's droning? So basically, we have to call 911 if there is someone droning. And number two, we have to get help. Notify a lifeguard if one is close. If not, ask someone to call 911. If you are alone, follow the steps below. So, number three, move the persons, and you have to take the persons out of the water. And next is check for breathing. Place your ear next to the person's mouth and nose. Do you feel air on your cheek? Look to see if the person's chest is moving. And number four, if the person is not breathing, check pulse. Checks the person pulse for 10 seconds. And next is if there is no pulse, start CPR. Carefully place persons on back. For an adult or child, place the heel of one hand on the center of the chest at the nipple line. You can also push with one hand on top of the other. For an infant, place two fingers on the breastbone. For an adult or child, press down at least 2 inches. Make sure not to press on ribs. For an infant, press down about 1 and 1/2 inches. Make sure not to press on the end of the breastbone. Do chest compressions only at the rate of 100 to 120 per minute or more. Let the chest rise completely between pushes. Check to see if the person has started breathing. Note that these instructions are not meant to replace CPR training. Classes are available through the American Red Cross uh, and local hospitals and other organizations. Repeat if person is still not breathing. Lastly, if you've been trained in CPR, you can now open the airway by tilting the head back and lifting the chin. Pinch the nose of the victim's close. Take a normal breath. Cover the victim's mouth with yours to create an airtight seal. And then give 1 seconds breath as you watch for the chest to rise. Give 2 breath followed by 30 chest compressions. Continue this cycle of 30 compressions and 2 breath until the person start breathing or emergency help arrive. And that is all for today, guys. Thank you for watching this video. Bye. Nice one.
Ay, na. Namurat ko.
20 minutes.
Nagkabalo. Nagkabalo.